Today, state lawmakers move forward with an effort to establish what could be the nation's first universal health care system here in California. That proposal now comes with a new push to increase taxes to pay for it. Fox 40 Capitol reporter Ashley Zavala explains the legislation and how medical groups are reacting to it.
Some California Democrats determined to move ahead with two bills that would create a universal single-payer healthcare system in California.
And the reality is our current system is insanity.
The first bill, AB 1400, establishes the healthcare program and its rules, which could cost about $200 billion. The other bill is called ACA 11. The constitutional amendment was unveiled Thursday as a set of tax hikes to help provide the money. Those tax increases would include an annual excise tax on businesses with an income of more than $2 million, a 1.25% payroll tax on employers with more than 50 employees, a 1% payroll tax on workers earning more than $49,000 a year, and a personal income tax for those making about $150,000 a year. If passed by the legislature, voters would have the final say on the tax increases.
A single-payer healthcare system is the fiscally sound thing to do, the smarter healthcare policy to follow, and a moral imperative if we care about human life.
Republicans pounced on the proposal Thursday. Some say they have concerns about how this would financially hit those already struggling with the high cost of living and rising inflation in California.
Voters have been very clear in recent ballot measures that sought to increase taxes that enough is enough.
The effort also faces mounting opposition from several groups, including the California Medical and Hospital Associations, insurance companies, and business groups. The coalition releasing a statement Thursday saying, in part, AB 1400 would immeasurably disrupt the health care that millions of Californians rely on every day and at the worst possible time. Because it was first filed last year, AB 1400 must pass the Assembly by the end of this month to have any chance of getting through the legislature this year. A hearing is scheduled for the bill next week. At the state capitol, Ashley Zavala, Fox 40 News.